Thanks, Angela. Tonight, community leaders are questioning IMPD's mental health resources after a man in crisis died in police custody. Herman Whitfield's parents are suing Indianapolis and Metro Police for their son's death. They say they called for an ambulance back in April because Whitfield was experiencing a mental health crisis.
Thought we were availing ourselves of services that they provide, and then they killed our son.
Police say they tried de-escalating the situation for 10 minutes when the 39-year-old moved quickly toward an officer and he was tased twice and handcuffed facing down. The lawsuit says police body camera video clearly shows Whitfield gasping and saying, "I can't breathe," at least 3 times while an officer continued to press down on him.
Doesn't make sense. People don't need to wound up dead just because they're in a mental health crisis. They need help. You just need to get the right personnel in to understand what's going on with the person.
This case has led to a lot of questions about the role mental health experts play in policing. IMPD does have a mental health crisis team, but some faith leaders tell us they want to know why that help wasn't available the night Whitfield died. And beyond that, when will mental health services get better funding through the city? Tonight, our Emily Longnecker went to city leaders for answers.
City officials say they're listening to the community, and that's why they're expanding the availability of licensed mental health professionals who can respond when someone calls 911 for a mental health crisis.
We're trying to help as many people in the community as we can.
Last month, we talked to IMPD Sergeant Lance Dardine about his work with the city's mobile crisis assistance team, a group of 8 IMPD officers, each one paired with a mental health counselor from Eskenazi Mental Health Center. Together, the team of 2 respond to 911 calls for help during a mental health crisis. If the call involves addiction or an overdose, sometimes a paramedic goes on the run too.
Mental health professionals literally are embedded with police officers.
Kimball Richardson's a licensed mental health professional with Community Health Network and also serves on the Marion County Crisis Intervention Team, helping to educate police officers about mental illness and addiction.
We're trying to teach officers just little points here and there where they can make a difference and intervene in a conversation that might help de-escalate a patient or a citizen.
Right now, the teams work Monday through Friday from 7:30 to 3 or 10 to 6. The city plans to expand that with a pilot program for a team of only mental health counselors available 24/7 to citizens in a mental health emergency.
There are definitely some instances where all it takes is a clinician to help that individual going through crises, but there are still instances where an officer should come, especially with weapons.
City officials are still developing the new pilot, expected to launch early in 2023, and plan to travel to Denver to check out a similar program there.
Our goal is to go out there and see how it's run there, see, what are the types of runs that only go to clinicians or for both of them, to make sure that we're laying this foundation in a strong way.
While the city waits on those programs, there are still a lot of unanswered questions when it comes to Herman Whitfield's death. The police body cam video has not been released to the public, but Whitfield's family has seen it. Police say that should be out to the rest of us soon. And what's next for the 6 police officers who responded that night? We know they're on administrative duty while the criminal and internal investigations continue. And lastly, Whitfield's cause of death. We still don't have results of his toxicology test. Of course, we'll keep following the investigation along with the investments in mental health resources for the city. You can find all of the stories we've done on this right now at WTHR.com.